Hello, everyone, and welcome to our Essential Tremor Virtual Education Forum. My name is Patrick McCartney. I'm the Executive Director of the International Essential Tremor Foundation. Today, we're going to be hearing from Dr. Pravin Khemani, who will be discussing the different common medications for essential tremor. But before we get started, I want to say a quick thank you to our corporate partners, Medtronic, Sage Therapeutics, Jazz Pharmaceuticals, Calihealth, Boston Scientific, and Praxis Precision Medicines. Now, their support allows us to provide these webinars, our podcast series, and our in-person ET education forums. Now I'd like to introduce our speaker. Dr. Khemani is the medical director of the Movement Disorders Program within the Swedish Neuroscience Institute in Seattle, Washington, and is also a member of the IETF Medical Advisory Board. He is fellowship trained in movement disorders from Stanford University Medical Center and is board certified by the American Board of Psychiatry and Neurology. So Dr. Khemani, welcome and thank you for joining us today. I'm going to stop sharing here so you can share your screen.
Certainly. Thank you, Patrick. And thank you, IETF, for giving me this opportunity to talk about medications for essential tremor. And I thank the audience in advance for your attention. So I'm going to start sharing my screen. And Patrick can tell me if he can see it okay. And then I'll start presenting.
There it is.
Good to go?
Yep.
Okay, excellent. So today we'll be talking about medications for essential tremor. Before I jump right into the presentation, these are some of my disclosures. So what are the learning objectives for today's conference or talk? We will briefly talk about what is a tremor, what are the various types of tremor, focusing primarily on essential tremor. And then we will talk about medications to treat essential tremor. What exactly is a tremor? A tremor is described as an involuntary rhythmic oscillation of any part of the body about a joint. The most common tremors we see occur in the arms and legs. Arms are more frequently involved than legs. Essential tremor occurs primarily in the arms. However, the head, the voice, torso, and soft palate, etc., other parts of the body can be affected by tremor. This picture over here demonstrates what is done in the laboratory when you're trying to measure tremor and put it on paper. This person has essential tremor. We have an accelerometer and other measurement devices attached to this person's arm. When the tremor occurs, the tremor over time is summed up, filtered, and transduced to produce this peak over here, this curve, which is in the range of 8 to 10 hertz, which is very typical for essential tremor. This red peak over here, which is of a lower frequency, about 4 to 6 hertz, is a characteristic of essential tremor. If you load the limb or the arm with a weight, the tremor frequency reduces. However, in the clinic, we don't have these contraptions to measure tremor. We go back to basics and do a thorough history and physical examination, which allows us to determine the cause of tremor. And sometimes we may need to do diagnostic investigation if there are multiple different movements or other confounding factors, but more often than not, the diagnosis of essential tremor is clinical. Before we talk about essential tremor and the ways to treat it, I'm just going to touch very briefly on the tremor circuit because this informs treatment and research. It's a very complex system in the brain that generates tremor, but fundamentally, the brainstem is connected to the cerebellum, which in turn connects to the thalamus, which connects to the motor cortex, or the cerebral cortex. These fundamental structures are connected by a circuit of neurons that fire abnormally, generating tremor. That is the widely accepted view among scientists. However, this is a very distilled and simplistic explanation. It's important to remember the circuit during research because a lot of research is directed towards disrupting the abnormal firing of neurons in this particular circuit. Moving forward, this particular schematic shows you the classification of various tremor syndromes, and we have about 17 to 18 tremors. And most of them are diagnosed based upon clinical characteristics, time of onset, what does a tremor look like, how does it behave during the day, what age does the tremor present, what are the other neurological characteristics associated with the tremor, and the cause of tremor. For today's talk, we are going to focus primarily on essential tremor and essential tremor plus. What is essential tremor? Essential tremor is a progressive action tremor of the arms. The head, the voice, the leg may be involved, but it's not necessary. Typically, we follow patients for about 3 years to ensure there isn't another neurological disease before we make the diagnosis of essential tremor. Now, this is not a hard and fast rule. If the tremor looks like an essential tremor, if there's good evidence that is behaving like essential tremor, the 3-year duration is not set in stone. Typically, in pure essential tremor, there shouldn't be other neurological signs. Artificially, we have divided essential tremor into essential tremor and essential tremor plus. Essential tremor plus is more commonly seen in the neurology clinic than essential tremor. It consists of essential tremor plus mild neurological abnormalities such as balance problems, memory problems, dystonia, which is another movement disorder. And these problems are important to keep in mind because if they worsen, they warrant treatment separate from essential tremor. But more often than not, they do not interfere with the treatment of essential tremor, and most medications are directed towards the treatment of essential tremor or the tremor part. It is important to recognize that essential tremor or essential tremor plus is the most common tremor in the world, and in the US, about 7 million people are affected by it at any given time. This is my transition slide. It tells me that we are going to jump into the meat and potatoes of the presentation. This is a lovely sculpture in the Minneapolis Sculpture Garden. If you haven't been, it's worth a visit. There are many more beautiful sculptures in this particular garden. All right, moving on to the treatment of essential tremor. The goal of treatment of essential tremor, like the goal of treatment of other diseases, is to durably improve function. And we have various ways to do that. Before we consider medications for essential tremor, it is important to look for conditions or situations that can worsen tremor. Some of these include thyroid dysfunction. It's very easy to check for thyroid function through a serum or a blood test and correct it. There is a long list of medications that can worsen essential tremor. Most of these are psychiatric medications used for psychosis. There's some cardiac medications also like amiodarone and antidepressants that may transiently worsen tremor. If someone is on these medications, it's important to review them to see if they can be decreased or eliminated. More often than not, these medications are necessary because they are treating some other disorder and we can't just stop them. Essential tremor is treated through 3 mechanisms: pharmacological treatment, devices or orthoses to treat tremor, and then surgical treatment for medication refractory essential tremor. For today's talk, we're going to focus primarily on drug treatment of essential tremor. This table over here shows the various medications we use in our clinic for the treatment of essential tremor. In this particular column, you have the name of the medication, and in the middle column, you have level of evidence. Level of evidence is derived from the quality of research studies that have been done to establish the medication's efficacy. The highest and the most confident level of evidence is A, followed by B, and then followed by C. Level of evidence A means that good randomized double-blinded controlled trials have been done to demonstrate the medication's efficacy. One of the most common medications used in the clinic to treat essential tremor is propranolol. It is a beta blocker. It is a heart medication that decreases heart rate and reduces blood pressure, but it also modifies the firing of nerve cells and neurons in the cerebellum, thereby decreasing tremor severity. It is the only FDA medication that is approved for the treatment of essential tremor. Another very common medication that we use is primidone. Primidone is an older anti-seizure medication that has demonstrated very good efficacy in the treatment of tremor. These medications have some side effects that we will be talking about in just a bit. The dosing of these medications depends on the patient's tolerance and the severity of tremor. Medications that have a slightly lower level of evidence for tremor efficacy include gabapentin, another anti-seizure medication, and topiramate, which is also an anti-seizure medication. These four medications are typically what is used most commonly for the treatment of essential tremor. However, the other medications such as atenolol and sotalol, nadolol, nimodipine, and clonazepam might be used. They're not very commonly used. Let's look at propranolol. Propranolol is particularly efficacious for the treatment of limb tremor, but also head tremor. Doses range anywhere from 10 milligrams per day to 320 milligrams per day. We really don't use very high doses, such as 320 milligrams per day, because propranolol is associated with these side effects: lightheadedness, fainting, lethargy, difficulty breathing if someone has asthma, decreased exercise endurance, and erectile difficulty in men. Primidone is very good for limb tremor or arm tremor and has a wide range of dosing, 25 milligrams to 750 milligrams per day. I rarely see people on 750 milligrams per day, and I really don't use these very high doses, again, because beyond a certain dose of 250 milligrams to 500 milligrams, it does not offer a lot of benefit. Plus, in larger doses, primidone is associated with dizziness, sleepiness, incoordination, nausea, cognitive changes, and it is notorious for interacting with other medications, particularly blood thinners and cardiac medications. Topiramate, which is an anti-seizure medication, is used in dose ranges of 25 to 300 milligrams per day. It is somewhat effective for tremor, but as the dose increases, we see side effects such as cognitive impairment, loss of appetite, blurred vision, and if you have a propensity to form kidney stones, this medication is best avoided. Gabapentin is a very common medication that is used for many different purposes: neuropathy, essential tremor, of course, restless leg syndrome, etc. And it is dosed depending upon the severity of the tremor in very high doses of 1800 to 2400 milligrams per day. It can cause sleepiness, swelling in the legs, and cognitive impairment. And so therefore, you have to be really careful with the use of this medication in very high doses as well. There is another medication that I've used in my clinic that has not found traction in the treatment of essential tremor because it's not very commonly used, is zonisamide. I have found that this medication is very well tolerated and has some benefit in the treatment of essential tremor, although it does not have very good evidence for the treatment of essential tremor. Unfortunately, over time, studies have shown that about 40% of people discontinue propranolol and 47% of people discontinue primidone. And this is primarily because of side effects, high pill burden, needing more and more medication as time goes by or the tremor severity worsens, and waning efficacy. The medications become less effective over time. So what do we do in that case? Well, we are looking at other modalities for the treatment of essential tremor. One mechanism or medicine is the use of botulinum toxin for essential tremor. Botulinum toxin is just a generic term for any one of these medications that are listed on this particular table, when I say Botox with a capital B, that refers to a specific brand of a botulinum toxin called botulinum toxin A. Most of the research and studies have looked at capital B Botox. A few studies have looked at Xeomin, which is another kind of botulinum toxin for treatment of tremor. Botox, Xeomin, Dysport, and Daxxify, which is the newest kid on the block, are called type A botulinum toxins because of their mechanism of action, and Myoblock is a type B botulinum toxin, again, because the mechanism of action is slightly different from type A botulinum toxin medications. This study was presented or published in a very prestigious journal, the New England Journal of Medicine, last year, and it studied the effect of botulinum toxin for isolated or essential head tremor. It was carried out in France. 117 patients were studied. One group got Botox and the other group got placebo. It was found at 12 weeks that Botox was more effective than placebo. People who did get Botox had swallowing problems, head and neck pain, weakness at the injection site, weakness of the neck muscles, and injection pain. These side effects were temporary. It is also important to know that the benefits of Botox are also temporary, and it needs to be repeated every 3 to 4 months in order to provide benefit. Botulinum toxin is not FDA approved in the US for treatment of essential head tremor. It is, however, approved for dystonic head tremor. The American Academy of Neurology gives it a level C evidence, which is not very good evidence for efficacy, but a more recent study suggests that it could be more effective than it has been, than studies have demonstrated, and it may have a level B evidence, so slightly better evidence than level C. In this particular study, Botox was injected into muscles in the back of the neck, which two muscles called splenius capitis. And these muscles are supposedly are oscillating or contracting abnormally, causing a head tremor. And so the toxin or the injections are done strategically in these muscles. And there is one splenius capitis on each side. What about hand tremor? Well, over time, about 3 studies, randomized double-blind controlled trials, have been done for the treatment of hand tremor. There were 2 trials with capital B Botox and 1 with Xeomin. It was noted that at the end of the research study, there was appreciable improvement in hand tremor, but unfortunately, there were temporary side effects of hand weakness. In addition, injection techniques, selection of muscles, doses, and outcome measures also varied, so it wasn't possible to compare one drug with the other. Important to recognize that no botulinum toxin formulation is FDA approved. It is not covered by insurance, and it is very expensive to the patient, so we don't use it in our clinic. So what unfortunately we have is a big gap in the treatment of essential tremor. If 40% of patients discontinue oral medications over time, and botulinum toxin is neither FDA approved nor insurance covered, and it is so expensive. So what do? Well, we go to research. And currently, I'm very happy to say there are a few drugs in the pipeline for the treatment of essential tremor. This column demonstrates the drug's name. Here, this demonstrates the status of research and the basic mechanism of research in the third column. The first drug, ulixacaltamide, which is manufactured by Praxis Precision Medicines, is in its final or phase 3 stage of research, and we should be seeing results maybe later this year. The mechanism of action of this particular medication is reduction of abnormal firing of neurons in the circuit that we talked about. This particular abnormal firing causes tremor. Capital B Botox has been researched. Currently, it's in the phase 2 or the middle stage of research. Botox, of course, works by paralyzing or reducing hyperactivity of muscles, which stops them from shaking. It doesn't it doesn't change the underlying cause of tremor, which is the abnormal firing of neurons. The third therapeutic agent is manufactured by Sage Therapeutics. It's called Sage 324. It's also in the middle stages of research. Sage 324 supposedly works on targets and neurons, reducing abnormal activity in the tremor circuit. So we see a theme over here that most of the research is directed towards decreasing the abnormal firing or changing the abnormal firing in tremor circuit. Jazz Pharmaceuticals is in collaboration with multiple centers studying JZP385 or suvecaltamide, which is in phase 2 trials right now. Again, the mechanism of action is potentially decreasing abnormal firing of neurons causing tremor. An Australian company is studying a drug called ES481. Not much is published about this medication. It's in the middle stages, phase 2 of research, and it is supposed to be an anti-seizure medications. If you want to know more about research in essential tremor, what's going on currently, you can visit clinicaltrials.gov, a website which has updated information on research on many different diseases, including essential tremor. So in summary, tremors are of various types. Essential tremor is the most common tremor diagnosed by a neurological history and examination. There are several drugs available to treat essential tremor, and essential tremor and the treatment is customized to improve function and minimize side effects. Unfortunately, there is a gap in treatment, so therefore we are very optimistic about various medications, including botulinum toxin, that are being studied to reduce tremor and improve function. Thank you for your attention.
Awesome. Thank you, Dr. Khemani. Just a kind of an update real quick for everyone. You had mentioned the SAGE and the JAZZ trials. Their phase 2 is actually both have closed now, and they are analyzing data with hopefully some good news for us here in the first half of 2024 and decision on whether they're going to move on to a phase 3, which is exciting. So good news for the essential tremor community. So Dr. Khemani, again, thank you for taking the time speaking with us today. You shared some great information on ET medications and other treatment options. We hope everyone found this presentation helpful and hopefully you learned something new today. If you have any questions about essential tremor, please feel free to visit our website at essentialtremor.org, or you can call us toll free at 888-387-3667. And finally, if you are a donor to the IETF, we want to thank you for your support. If you aren't currently a donor, we hope you consider a gift to help us continue the work we do promoting ET awareness, education, support, and research. We plan on hosting a variety of these virtual ET education events in the upcoming months. So look for notices about these events in our Tremogram e-newsletter, our social media, and our Tremor Talk magazine. So thank you, everyone, for joining us today. Dr. Khemani, thank you for taking the time to speak with us, and hope everyone has a great day.
Thank you very much, Patrick. Take care, everybody. Bye.